Dr. UeJin Kim. I'm a dual board certified psychiatrist in Texas, and this is a presentation that I gave to local church just because I'm very passionate about bringing the world of church and spirituality and mental health together. I don't think they're adverse or in disagreement with each other. I think they're very synchronous and synergistic. And I hope you did enjoy your presentation. And if you have any questions, please email me at restorepsychiatrymd@gmail.com. So when I was thinking about possible topics to talk about mental health, one reason why I wanted to start a private practice and put my Christian faith on my website, which is kind of taboo and a risky and possibly ethical issue for psychiatrists to do, was because I knew that there's a lot of people in church with mental health and there was a division to seek help. You know, there's a lot of obstacles and stigmas that I knew that believers have to go to seek help. And that's why I put the Christian out there, just to kind of ease that, access to care. So I'm gonna be sharing what I learned in training and what I learned in my life with my personal relationship with God, and how it's not different. It's very much the same, and I wanted to kind of portray that. So today our objectives, we're going to be discussing the definition and components of mental health and understand the difference between mental health issues and mental health disorders, and at the end we're going to discuss the presence of mental health in the Bible and how God addresses our mental health or emotional issues. So this is a disclaimer. Denise did a really good job saying that I'm not your personal psychiatrist today, but I'm available to answer any questions. And I know that this presentation alone is not a start of patient-physician relationship. Patient-physician relationship is very intimate, and this is not the time and place for that. So whenever we go to the question and answer portion too, whenever you're asking a question, try to refrain from giving specifics like, oh, my son or my cousin, because those are technically patient health information. So just kind of ground rules there, okay? So what is mental health? I think COVID did a great job of bringing up the issue of mental health crisis in the world. And now depression is one of the top reasons of morbidity and mortality in the world. And financially, I think I picked the right career because there will be always a job for me. But what is mental health? So let's define that. So mental is related to the mind and related to the disorders of the mind. And health is the state of being free from illness or injury related to being whole. So the emphasis here is mental is related to the mind, and health is being free from illness or being whole. And the reason why I emphasize that is sometimes the word mental is used like an adjective, like in British slang, like, oh, that was mental, that means kind of like that was crazy, or like that's off the charts. So I'm gonna be using these definitions to kind of describe what does it mean in reality and clinically. So which organ controls the mind? So my background is being a medical doctor, MD, so we have to study all different kinds of organ systems. And these are the pictures of roughly, not all, but some of the organ systems. And the organ that we study the most as a psychiatrist is the brain. And brain has two functions. It has neurologic functions and mental functions. And neurologic is kind of like sensing, moving, kind of more functional, and mental is more emotional and cognitive. So how does brain decide and think and feel? So what happens is different organs, even your internal organs, has a lot of inputs of data that they gather, pain or what we see and hear, and they relay it to the brain. And brain does amazing stuff in the organ and processes it and organizes all the sensory inputs and then relays the same message to all the different organs. Okay, so this is a very simplistic explanation of how the brain works. So how much of the mental health is due to biochemical imbalance? There was a recent study that's called meta-systemic studies, which is like you kind of step back and you look at all the different studies and say, what is the conclusion of all these different types of studies? And it came out saying there's no relations to depression and serotonin. So I kind of want to bring that up as of, does that mean that I have to take antidepressant, if I don't have chemical balance? And we'll definitely address that in the later, but this is a good question to kind of explain to you another way of looking at mental health. So we looked at the organ system, right? The clinical medical part. Now this is more a conceptual diagram that we use in psychiatry and mental health. This is called Biopsychosocial Model. And this is what we go off to use to assess and treat, the patients. So example of biological components of mental health that contributes to your health of your mind is like general medical condition, so dementia, and sometimes if you have hepatitis, it can affect how you think and feel, IQ, genetics, biochemical imbalance, so that's a component of biological factors. Intrauterine exposure, that's like when you were in the womb of your biological mother, was she exposed to any trauma or medications or substance? So this is what I mean by intrauterine exposure and substance abuse. So you know that there's a biological component that is feeding our mind. The next is psychological. So your mood, how you feel, sensory comprehension as of how are you comprehending the inputs, that different organs kind of pick up. Personality, emotional resilience, ability to focus, ability to relate to other people. These are kind of components of the psychological components that feeds into our mental health. And then there are social components like your friends, community, upbringing, bullying, hobbies, trauma. So these are social components. Now, when we are trained in a secular training, there's not a sphere of spiritual components. It's mainly biopsychosocial model. But the more that I kind of learn from the training and kind of incorporating my spiritual kind of background, what I think fits the best is spiritual components kind of feed all of this. So spiritual, when I say spiritual, I don't necessarily mean Christian. Spiritual is like a sense of belonging, sense of purpose or calling or sense of worth, and you can kind of see that kind of spiritual component is like the river that runs underneath all these biopsychosocial components. It will kind of send the direction. So this is how I conceptualize spiritual components when I'm assessing the patient. So what can we control and change? Because when you look at all these different components, you can see how each component contribute to your mental health, right? And our first question is like, how can we improve our own mental health, right? But actually, only the ones that I highlighted are dynamic. This dynamic, not even saying that you can control it, is something that can change. So if you look under biological, we can't control our IQ. We can't control our genes, and we can't control a lot of our medical conditions. The only thing we can maybe choose in a way is amounts of substance that we use. And under psychological, we can't really control how we feel. We can't control how we comprehend all the sensory inputs, but the things that can change over time are emotional resilience, ability to focus, and ability to relate. And sometimes those are not really in, quote unquote, in our control. And social, only thing we can't really change how we were brought up. We can't really change what kind of trauma or bullying happens to us and not happen to us, but we can choose our friends, community, and hobbies. And spiritual, the sense of purpose and belonging and meaning, I highlighted it because it's dynamic and it can change over time, but we all know that it's a journey, and there's a lot of components in our spiritual journey that we can't control, right? So I want to highlight this because there's a lot of stigma of, oh, you're depressed because you choose to be depressed, or you're depressed because you're lazy, or you're tired because you just don't put yourself, And this chart clearly states that there's a lot of things that are not in control in our mental health, and I just wanted to emphasize that. So I mentioned emotional resiliency as part of one thing that we can control, and this is what I focus on whenever I see my patients over a long period of time, so I want to explain that. And is everybody kind of following through? Is this pretty big? Yes. Okay. So mental and emotional resiliency, what is that? So this is another conceptual diagram of how our mind processes sensory, and we'll definitely go into the examples of it. So this is called cognitive triad, and this is something that cognitive behavior therapy is based on. And this is a relationship between thought, emotions, and behaviors. And I put the arrows only one direction, but it can go the other way too. It's bi-directional arrows. And this explains how we process our life events. And I'll give you some examples, okay? So scenario number one. I don't know if you've been in my shoes, but there are some times where I will text my husband or, and he doesn't respond right away. Can anyone relate? Yes. So I put pictures there that I'm texting and I'm seeing the lack of response and I'm hearing lack of, notification, and that's the situation, that's a life event, right? And what's my first step? Yeah. Is he cheating on me? Is he dead? What is he doing? What is more important than my text, right? That's my thought. Can anyone relate? So then it leads to emotions of anxiety and fear, right? Insecurity. It brings up a lot of emotions.
Big time.
And then what would be my behavior if I'm feeling that way? Hammer texting. Are you okay? Are you dead? Are you cheating on me? Or leaving, yes, leaving 1,000 voicemails of anger, maybe yelling at him, right?
Right, exactly.
And what does my behavior do? It creates another situation that just takes it and runs with it, right? So I'm talking incessantly, we get into fights, I'm hammer texting. This creates another situation that will repeat the cycle in that direction, okay? Now, let's look at scenario number two. So the first situation is the same. I'm not getting the response in a timely manner from my husband, and I'm seeing and hearing still the same lack of response. But another way to look about it in this scenario is my thought is, okay, he's not responding. I remember he told me that he had a lot of meetings today. Maybe he could be in a meeting, or maybe he's just ignoring my text. Leads to emotions of not freaking out, right, based on that thought, but more cautious, right, exploring options. I'm calm. And then it leads to behavior of maybe waiting for him to text or sending one text. Hey, I tried to text you. I didn't get a text back. Let me know when you're out of the meeting. It's less reactive and it's more thoughtful. So then it creates a situation that's a little bit more calmer where I'm texting, very calmly once or twice, and then I'm just waiting for, the next situation to occur, right? And these two scenarios are the difference between mind that is fragile and mind that is resilient. And the picture here of the muscle is that this is a skill that grows over time, and it has to have practice. We don't all wake up one day and become mentally resilient. Sometimes that's what we want, but can you imagine from first scenario me overnight turning into second scenario me? That's impossible. So this is an element that takes patience and practice. And these are the difference though. And this is a journey that I want to focus on, whether you're mentally have disorders or not. Being mentally and emotionally resilient is a skill, is a muscle strength, is something that we can all work on. And the results are drastic. Like mentally fragile mind is reactive, it acts immediately, it misfires the cognitive triad, and it lacks in real life processing, it lacks insight, and lacking boundaries and is very insecure. But mentally resilient mind, they thought through multiple scenarios and multiple perspectives, is slow to react, is a controlled buyer of cognitive triad, and it can process things immediately, right? Not in hindsight. Hindsight is always 20/20, but resilient mind can process things in real life, is very insightful, and has balanced perspectives, has boundaries, and is very secure as much as possible. So, just to kind of take away is that mental and emotional resiliency is a component of mental health, and that's something that we can work on. We can't control a lot of things, but this is something that we